Hi, everyone. Thank you so much for joining this webinar today. Today, we're going to be discussing a grant program with you all from the USDA, the RUS DLT grant. But before we dive into that, I just want to give you a quick agenda of this session and a few recommendations for decorum and your participation. So we're going to start, like I said, with an overview of this grant. Then we're going to spend some time on some Zoom demos, walking you through technology that aligns very well with this grant program. So before we dive into this grant program, I do just want to introduce you to the Zoom Grant Assistance resource. We are a free resource available to Zoom's customers in education, healthcare, and government. We are powered by a third-party grant consulting firm called Learn, Design, Apply. And again, we're a free resource. We contract with Zoom and we provide all kinds of grant and other funding assistance to Zoom's customers. As far as services that we offer, there's a really wide range of services that you see here. We do a lot of grant education, presentations like this today, a lot of one-on-one grant consultations. We're here to help you find grant programs that align with your organization, your goals, and your initiatives. And most importantly, we want to find programs that you are competitive for and really support you throughout the process of pursuing those grant programs. So if you're going to apply for something, we can work alongside your grants team. If you have a grants team, we can work, if you don't have a grants team, we're happy to take on essentially, as much of the grant application process, assisting you through that as you see fit. We do have the one restriction of we can't serve as your grant writers because we do represent Zoom, a vendor. So if you're looking for an actual grant writer, we're happy to connect you with somebody that we've worked with who's external to our organization, somebody who knows, if it's a telehealth project that you're pursuing or a continued medical education project, we can connect you with somebody that knows your particular focus area really, really well. And then we can also be there for you after you're awarded. Hopefully you are awarded, but if there's any questions on post-grant implementation steps, from paperwork to, who do I reach out to for questions? How do I submit my reimbursement request? We're there to assist with all of that as well. So jumping into this grant that we're going to talk about, again, it's just one of the many grant programs our team focuses on. It's a grant from the USDA from their Rural Utility Service, and it's a grant for distance learning and telemedicine. We often call it the RUS DLT or just the DLT grant for short because the full name is quite a mouthful. I'm not sure how many of you are familiar with this program, but just to give you a little bit of context, this grant has been around for a very long time. It's a pretty long-standing, reliable program. It's been around since the 90s, and it funds interactive, real-time distance learning or telemedicine projects that bring services out into rural communities. The goal of this grant is really to help bridge the digital divide and to get educational and healthcare resources out to communities who oftentimes have a really hard time accessing these resources. This grant is very unique in that it's very technology focused. So if you're familiar with other healthcare grants, perhaps HRSA grants, for instance, or SAMHSA grants, a lot of times those will be a lot broader in what you can put in the budget. This grant, as far as what can go in your budget, is pretty specific. What it provides funding for is interactive technology that's going to facilitate a live collaborative telemedicine consultation or an educational session. That's what this grant is really, really good for. Another unique thing about this grant is really almost any type of organization can apply. So first, you can be an organization in a non-rural area and still be involved in a project. You might be the lead applicant, and it might really be your initiative and that will, totally be fine as long as you're using the grant dollars to bring services out to rural communities. You can totally apply as urban, non-rural applicant. And a lot of times that is who ends up going for a lot of these grants, or at least partnering with rural organizations, because that's where a lot of resources tend to be concentrated. And another point on this is you're very free to work with essentially whoever you want to work with on this grant. Again, there's a few restrictions, but informal consortiums are able to apply for this grant. So you don't have to have a firm formal partnership with somebody in order to work with them on a RUS DLT project, also making it unique compared to a lot of other grant programs. And lastly, I did already touch on, this being a very consistent and reliable source of funding, a very long-term program. But another thing to note is this grant, if you look at previous awardees, there are groups that win this funding time and time again. In some ways, they almost, I feel like to award some of the same groups time and time again. It's not a disadvantage if you receive this funding, in the last few years to try to apply again, as long as you're not duplicating your project. So you want to be either bringing new services to your project sites or potentially expanding services to new project sites. But as long as you're not duplicating, they love funding groups who are confident and comfortable doing rural outreach, who have some experience doing this type of work. And again, if you've gotten this funding before, it doesn't prevent you from getting this funding again. Now, jumping into some details, a really key piece of this grant is your project design. And there's a few different ways you can design a project. I'm going to just touch on them at a very high level here. Again, please reach out to grants@zoom.us if you want to explore potential project designs for your organization and your current initiatives. But one of the most popular project designs is the first one here. So you're either going to be connecting multiple rural sites to one another to share resources, or you'll connect rural sites to a hub site in order to obtain resources. So just a quick example, for the first part, you might have maybe multiple rural clinics throughout a county working together to share primary care physicians, to share nurses, maybe to share some specialists as well. But then for the other option, you might have all those clinics maybe connecting to a large hospital, again, in a big city where they have a lot of resources. They might have a lot more staff available, a wider variety of specialists. And again, that totally works. You can have that kind of hub spoke model where you're connecting to a larger metro area as long as the services are going out to rural communities. There is also an option to connect with mobile units such as ambulances, mobile learning stations, or individuals in their home. If you're looking to maybe bring telemedicine services to individuals in their home, there is just an additional restriction with that, where under that project design, the content has to start from a rural provider. So essentially think of it as if you're trying to send services out to a patient in their home, typically you're going to want to have that maybe provider or that information originating from a rural clinic, let's say. But the key piece here, I think the biggest takeaway is just to keep in mind, this grant really cares about the physical location of your project sites. And a lot of times when we have a consultation on this grant, that's one of the first things we ask you. Where are you located and where are the people who you are trying to bring services to located? Again, I see some questions coming in. Thank you so much. We'll get to those in just a bit, but I'll go ahead and take you through the other pieces of this grant. So as far as budget and expenditures, this is a 3-year grant program. You're free to implement, kind of as you see fit throughout that 3 years. Any kinds of services you get can be covered for the full 3 years of the grant. As far as match and award range, there is a match required with this grant. It is 15% of your federal request, so essentially of your grant amount, which ends up being about 13% of your total project costs. So to give you an example with real numbers, let's say you're requesting $1 million in your RUS DLT project. That's the maximum historically in the last few years that you've been able to request. So let's say you're requesting the full $1 million. That means you would match at least 150,000, making your overall project costs 1.15 million. And as you see here, historically, again, at least in the last few years, the grant amount under this program ranges from $50,000 all the way up to $1 million. As far as what's eligible, I know I touched on this, but again, just reiterating, this grant is really focused on technology. So it's focused on things that facilitate that live, interactive, again, educational or telemedicine experience. You could have video conferencing room systems, maybe for your continued medical education. You can have telemedicine carts. You can have, as I said, telemedicine services into a patient's home using some kind of device like a tablet, maybe, or a computer. Software that facilitates this live interaction, services such as installation or technical training, warranties for the full 3 years of the grant, that can all also be covered. And then the last bit, timing. So this grant usually comes out every year. Currently, it's not out. It's not accepting applications at the moment, but we are expecting that period to open up very soon. What we've heard is likely late 2023 or early 2024. Once the grant is posted, it's a fairly quick application window. It's typically just 60 days to apply. So we do always recommend thinking about your project early. Honestly, a best practice is to start planning your project before the official guidelines are even posted for that year. This grant doesn't change very much from year to year, so you can always look at last year's guidelines to at least start developing your project. Now, I want to walk you through just a few healthcare project ideas for this grant, but I really want to stress this is not an exhaustive list. These are just a few examples and things that we've seen be popular, especially in recent years. As I said before, this grant is very open-ended in terms of who you can partner with. And it's also pretty open-ended in terms of what qualifies as telemedicine and also what qualifies as distance learning. So there's a lot of things that can fit in here. Again, some examples that we see listed here, but just examples, you really have it's very flexible. You have a wide range of projects that you can pursue under this grant. The first example, I think this is very, very popular, is sharing medical personnel. I already alluded to this, but of course, rural facilities oftentimes do not have adequate staffing to address the demand of their communities. So you might be sharing all kinds of medical personnel, doctors, nurses, allied health professionals, dentists. We see a lot of teledentistry projects under this grant as well. And you can either provide telemedicine services directly to patients located in rural communities, or you can follow a model where you're providing, peer support or guidance sort of from medical personnel to other medical personnel and kind of collaborating and making sure that those personnel, in the rural community can meet the needs of their patients. Second one, continued medical education. Again, very, very huge. We see, a lot of times it's really hard to get this type of education in rural communities. You have to drive for hours and hours to meet the requirements. And again, continued medical education is really great under this grant. We've been seeing a big expansion of school-based health, especially in the last few years. And then we've also been seeing a lot of telemedicine services in public spaces. So we see telemedicine in libraries and community centers. There, of course, in these rural communities, a lot of people don't have connectivity in the home. A lot of people, again, need these services. And sometimes libraries and community centers are, the one shared kind of public space that's pretty accessible in rural areas. So a lot of telemedicine services, again, in spaces like that. Also, potentially healthcare education in spaces like that. To the last point here, you can do all kinds of community healthcare education under this grant. We see things for nutrition, diabetes prevention, wellness, again, a lot of mental health education in the last few years. So that is all totally possible under this grant. Also, telemedicine into prisons and jails, especially around mental health supports. We've seen a lot of projects under that. Again, these are just some examples, hopefully get the wheels turning. And if you're sending in questions, we'll respond as soon as we can. But just wanted to give you a sense of what can be covered under this grant. As far as next steps, I know I've mentioned this already, but please reach out to our team. You can contact us at grants@zoom.us. We would love to see if this grant is a fit for you or if there's something else on the horizon that might be a better fit. If you do want to pursue this RUS DLT grant, one of the first things we recommend is just High level, what is your project about? What are you looking to do? Is it going to be just a telemedicine project? Are you going to have some educational components in there as well? And who are you going to work with? Are you keeping it all internal, or do you want to work with external partners as well? And then the next bit would just be to think about your locations. Again, like I said, the location of your sites is really key to your competitiveness under this grant. So we really recommend looking at this early. See if, maybe there's some partners that you work with that would be a bit more naturally competitive for this grant. We're happy to help you figure that out as well. So again, please reach out. We can have this consultation with you and proceed from there. Here's our email one more time, and I'm going to hand it over to Myrella.
Vicki, and welcome everyone to San Jose, California. Not at all a rural area, but we're going to be bringing you live the experience a day that you would expect. Let's say put out some good vibes into the future, and let's say that you guys get awarded this amazing RUS DLT grant. Think about how this can be leveraged in your day-to-day. Right, so what we've got here is a Zoom room running on a kiosk mode to allow users to self-navigate when they come to your facility. Now, let's back up just a moment. What is a Zoom room? A Zoom room is a software-based solution that does need hardware. The RUS DLT grant will also help with the software and the hardware component. Every Zoom room does need a dedicated computer, microphone, speakers, a display, and a controller. In our instance, we're going to be using an all-in-one that consolidates all of that in this single device, makes it very simple and easy. And in this instance, the Zoom room is running on a kiosk mode. As I approach this kiosk mode, let's say I'm one of your patients, I can self-navigate on the screen, choose that video icon, which is virtual receptionist. Think about, in this case, I could be coming in and I want to be admitted into the clinic today. I can simply select one of the options. On the back end, it will be simple Zoom meeting and somebody can answer that. In this instance, let's go ahead and reach out to a receptionist.
Hello there. How can I help?
Hi, I'm here to check in for my appointment.
Yeah, of course. Thanks for checking in. You're all set.
Thank you. All right. Use the art of the possible, your imagination for your environment. The next flow here is we're going to go ahead and go inside of the conference rooms. All of our conference rooms have the option to integrate natively with Office 365, Exchange, and Google Calendar. You can even put these displays outside of your conference room, alerting what the schedule is for the day and if the rooms are occupied or free to use. In our instance here, we are in a large, medium-sized conference room, comfortably seats 12 to 13 people. Think now we are in a boardroom. These are all imaginary doctors, and we're talking about how we're going to save the world from a particular disease, right? Diabetes, for instance. Let's talk about diabetes. And all of these individuals here, they have a lot to say. They've got a lot of stake in the matter. How are we going to help to ensure that they're all being heard, captured, and it's a very simple process while they're here? Well, the Zoom rooms can help us achieve such that, and it's very simple to deploy and scalable for you, the administrator. Now, what we've got is an all-in-one concept. Again, the camera, the speakers, the microphone, all built in into the device. As you can see behind the scenes here, we've got HDMI to the monitor and power. That's pretty much all that is involved. Let's go ahead and show you the call quality from the room. And what I'm going to do is bring up my mobile device, which has a Zoom Room controller app installed. I've been able to simply select control and pair with the room, and now I can have one click to join.
As you see, I can monitor the entire experience from my own personal device. I can gravitate towards any seat as a result. I can manipulate the camera, I can chat, I can have my reactions. All of that is available to me right here. More importantly, however, the reality of the matter, Vicki, is that these experts, while they're here, they are brilliant minds, and yet they can probably figure out how to do just about anything, but we don't want the technology to be intimidating for them while they're here. We really want this to be a very hands-off experience, and we can provide that to them. In this instance, what we even have is a Zoom room running on a kiosk mode, allowing me to use the additional camera that's installed in the device. This is a capacitive touchscreen. I could use this to also whiteboard. Now, the pre-installed monitors are not capacitive touch, so allowing me to use this all-in-one, I wheel it in, I pair it in the cloud. Now we have even the option to start annotating. We can start talking about various different things, choose between about 100 or 200 templates on the go. Our whiteboards are meant to be used before, during, and after the meeting. So this is ongoing, and we can continuously collaborate. You're not losing my facial features here in the room either. Let's go ahead and go back here to the controller on the table. What I really want to select is the auto framing. Auto framing enables the camera to detect my movement as I go around in the room. I'm seated right there, being very nice and studious, paying attention. But let's say I want to walk around. I want to be able to talk to any of these physicians, maybe take a look at whatever documentation they have. Notice that the built-in collaboration, even though it's not Pro AV, I'm still able to be heard and captured, and I have overflow content here for me as well from this additional Zoom Room companion mode. It just all comes together for a very simple user experience. I'll take you to our next stop.
All right, let's take our storytelling journey to the next level. Vicky, what I'm about to show you is a patient room of the future. So let's see how Zoom rooms can potentially function in the healthcare environment. Ultimately, what we're trying to do is we're trying to address that there are limited resources for healthcare. I mean, this is a real big world problem. How can we help these doctors and physicians expert be in more places than ever before and ensure that everyone is getting equitable healthcare that we all deserve? Well, in this instance, we're going to talk about 4 different use case scenarios and how we can potentially address that with Zoom rooms. First case scenario, welcome to the patient room of the future, where we are using a patient engagement platform. Now, Vicky, what I've got here is a pillow speaker. The patient is navigating on the engagement platform, so maybe they want to see their doctors, learn a little bit more. Maybe they're watching TV. Maybe they want to order their lunch for the day. They are just using the technology that they're accustomed to that's part of the hospital. Now, at any moment, you'll notice that I can receive a call from doctors or friends and family, perhaps. I have the option to simply accept.
Hello, Mr. Lawson. Dr. Wilson here. We got the results of your lab tests back, and it seems you have a rare case of synthetic plasticosis. The good news is you will outlast us all by hundreds of thousands of years. We'd like to get a closer look at your condition. We will transfer over to the medical part now.
All right, so Vicky, now that was pretty remarkable. Can you imagine if we would have had this 4 years ago, right? This really would have greatly helped even to heal the process of our friends and family that were hospitalized, and it's still very helpful today. Now, what we've got here is the next use case, which is we're in a rural area, very rural in fact, and all I am is a nurse practitioner, and the doctor is remote. Now, what I can do as a nurse practitioner, let's say if I wanted to put this dermoscope right to the patient, in this case, I'm just putting it onto my skin, I could do so. I could take a picture. The doctor can see all of that remotely. And what we've got on this utility cart, different various options that we can use to help diagnose the patient. And this, meanwhile, the nurse practitioner is fully trained on how to do this, and the consultants on the far end, of course, are the ones that are making decisions, providing that consultation. Now, This Pinocchio is indeed made out of plastic. So let's go ahead and now go into our third use case scenario. We're wheeling him into our surgery room. Our surgery room is once more supplied with a Zoom room and various cameras. Our Zoom room natively can support multiple streams as well as the simultaneous streams of those cameras. So you can actually have one camera at the patient, one camera at the incision, one camera at the physician. And that physician has the option to even manipulate the camera, allowing them to get that front row seat of that experience. Now, of course, these all have the option to come together to bring anyone all over the world with the expertise that they have to ensure that this patient comes out of this surgery. Well, in this case, Pinocchio is turned into a real boy, perhaps. All right, the next use case scenario. This one here is what we're calling, or the industry rather, is calling it a Zoom room on a stick. All right, what we've got here is a very simple iPad. We are hardware agnostic, and here the patient or the nurse can answer a call even from their doctor.
Okay, Mr. Lawson, it looks like you're ready to be released. If you notice any changes in your body, please let us know.
The discharging process now can be faster than ever before. Think about the use case scenario here. Doctors are so limited, and now they can make their rounds virtually, and the patients can be discharged much faster than ever before, and their healing process can be greatly improved because of their ability to connect even with friends and family during the healing process. So that was a little bit into how we can potentially bring Zoom rooms into your healthcare scenario. Now, what we could also do in the hospitals is incorporate digital signage. Digital signage allowing you to showcase relevant video information, maybe the latest and greatest in a particular drug that's been released. It depends, of course, on the specialty that you have to offer, but you upload all of that content into our Zoom cloud. One very simple place to manage everything digital signage and everything that you're seeing in our tour today. You can even use our digital signage far beyond just showing presentations and videos. You can also use it for collaboration purposes. There is a sharing key located on the top right-hand corner of that screen. You can now share content from your device, your laptop, into digital signage if that's a use case scenario that would be applicable. You can also tie this in with Zoom phone for E911 procedures and protocols. Should there be an evacuation in place, you can alert all of your Zoom rooms and standalone digital signage players for evacuation to take order immediately. All of that and the ability to stream live Zoom meetings to your digital signage, providing you with options for overflow areas, all as part of what we offer with Zoom rooms, and even more, Vicki, because this is an abbreviated tour, only 15 minutes. We typically can talk about the entire portfolio here in about an hour, but in respect of time, we're just highlighting some of the art of the possible within our ecosystem, which brings us next to our classroom. The classroom here is going to help me illustrate the additional benefits of the Zoom rooms, that we have access to all of these tools locally or during a hybrid meeting. One instance, for instance, could be, let's say, in this style of an environment, if I wanted to bring up any previous whiteboards that I've been working on, like let's say, for instance, here's an x-ray, here's my patient, the last appointment with this patient was on November, etc. I can make annotations, etc. here. Anything that I do, anything that's relevant to this whiteboard, it will be saved on the cloud and I can revisit at any moment. I can even elevate this call to a video meeting, allowing additional virtual contributors to add in their insight to this patient. I'm not even in the meeting yet, but of course I could have brought that whiteboard into our meeting right now. What I can also do is share content wirelessly here in our Zoom rooms. Okay, all I need to do is use the Zoom client, select share screen. This is going to allow me to push real video, audio, full media into the Zoom room and potentially even annotate on top of that content. This could very well be an X-ray, various different options. I can also send this collateral to myself via Zoom chat or email it to external user. Furthermore, what I also have the option to do is join other meeting platforms as a guest. What I can do is simply select, let's say, Google Meet meeting. If I need to, from the Zoom room, join a Google Meet meeting, I simply input the credentials and I'll be on my way as a participant. Same with Cisco WebEx and Teams. What I can also do is invite the Zoom room to that meeting, and I would have a one-click to join, as you see there as an option, okay? Very well. Another consideration in the Zoom room is you can enable Zoom phone in your spaces, and now you're removing additional intimidating hardware that can make these interactions rather complex. So all I need to do is go ahead, dial a specialty doctor that was not able to join today, and if I want to ring them, I have the option to do so. Okay, awesome. What's next? Well, let's go ahead and join the meeting. Again, with our integration with Outlook and Google Calendar, I have one click to join. I can also say, hello Zoom, join meeting.
Do you want to join the meeting?
Yes.
Starting the meeting.
Back to the scenario where we are in these spaces and we want to ensure that there's just enough meeting equity and we have enough coverage here across the board. You'll see that I have yet once more a Zoom room companion mode here. This is basically being used as a confidence monitor. I can see what's going on, but I have additional considerations as well too. Back to the point where if I want to share content, I can do so through proximity sharing wireless, but I can also do HDMI. I've got here, let's say, back to my patient and her x-ray. You can also actually use the Zoom room itself to annotate and highlight that fracture on the screen, making sure everybody's on the same page.
We're going to showcase our multi-stream capability, which you already saw in the medical space, and our multiple cameras you also saw in that instance. And we're going to bring that together in this boardroom with Intelligent Director.
We've got here one bowling alley view of the conference room table. However, not good enough. So what we can do through the Zoom room on the controller is I can do multi-stream. Multi-stream is Zoom room's ability to bring in those multiple streams into the call, and we are using artificial intelligence to make sure everybody is captured. But what we've discovered is that not everyone is actually captured, even though we have multiple streams and we're able to bring that Brady Bunch instance here into the spaces. Now let's go ahead and activate Intelligent Director, which is also waking up those additional cameras, using artificial intelligence once more to scan the room, ensuring indeed we are capturing the participants around the conference room table. Notice that on the one single view of the camera, Ed wasn't visible at all. Go to the very back of the room and I sit down once more. Notice that the technology is working for me. I am not working the technology to dictate what it needs to do. It's all being leveraged by the Zoom Room software. I can even come all the way to the side. If I'm obstructed by anything, there's a better view of me as the main participant. I don't have to do anything. That camera auto switches with absolutely no user intervention, right? This just makes it very, very simple for any end user to interact with the technology because the user interface is consistent and built on simplicity to ensure everyone is happy and can be productive. Thank you.
Generally, this grant is really focused on technology. There is some instructional programming you could purchase as long as it's a capital asset, capital expenditure. So for instance, if there was maybe some educational institution you were trying to join to participate, have your providers participate in their classes, and if that could be set up as a capital expenditure, that may be eligible. But generally, this grant is for, technology costs necessary to facilitate communications into rural communities. It's not going to cover, again, the personnel and the provider costs. It's all about creating the connections, again, at least under this grant. If there's other needs that you all have in addition to technology, there's always going to be other grant programs that will be a little broader, and you can reach out to our team to explore that further.
Is this tech and capability mostly available in Zoom, or is it also somewhat dependent on the hardware itself? So I'll answer that like this. The power of Zoom rooms is what drives everything. Hardware agnosticism is kind of at the core of what we do. So you can take, off the shelf, really inexpensive hardware and have a fantastic experience. Like for the smart features you're seeing, doesn't have to be an expensive camera. Zoom Rooms is going to do that for you, manage that whole system. And that's kind of the point of what we're doing here, to make it easier on end users, on admins, and on patients, simplifying all of that. So of course, we have some appliances like you've seen today that are really easy solutions. But if you have a PC or a Mac Mini and you want to use what you have off the shelf, we totally handle that too. And that's the beauty of kind of being inside this environment.
This grant will not fund the actual physical location. That is a good question. So you can't have the facility cost, purchasing a facility or leasing a facility. That's not going to work under this grant, but it will, again, get you the technology that's necessary for these connections. And then certain other things, like the grant can cover, historically, up to 20% of the grant can go towards broadband infrastructure. So maybe if there's like a last mile fiber connection you're trying to set up to a facility. Also internal wiring, if you're trying to use a facility that, maybe just is older and not up to date and not able to handle video conferencing at the moment, you can set up wiring that would be necessary to get it to that point where it's enabled for connectivity, but not general facility costs. Please reach out to grants@zoom.us, and we would love to answer your questions and, again, set up conversations with as many of you as we can, as soon as we can. Thank you so much for joining this session. We're excited that you're excited, and that you're excited by these technologies and by this grant opportunity itself. So thank you all so much.